patients reach. At KIMS Sunshine Hospital, patient safety has been the cornerstone of care, a global pioneer from India for clinical grade remote patient monitoring and early warning system, whose technology seamlessly integrates into hospitals' clinical workflows, allowing care teams to stay one step ahead always. To share how this vision came to life, we are honored to have with us Mr. Sudhaker Jadhav, sir, Chief Operating Officer, KIMS Sunshine Hospital. Sir, I would like to invite you to share your thoughts on how Smart World program reflects KIMS Sunshine's ongoing commitment to world-class patient care and safety.
Minutes, we will take you through as to what KIMS Sunshine Hospitals has done in association or along with Dozee. So fundamentally, as Krishna said, that this is a smart ward program where we have used remote patient monitoring as well as early warning sign technology to save patients' life. So this has been going on since 1 year. What I do is I'll present certain case mix and also the statistics as to how the entire Dozee concept actually helped our patients. Before Dozee, when we started, I think probably it's been a year now we have started with Dozee, so we were actually waiting for substantial data to present. But let's take one step back and look at the scenario of what we were doing before Dozee. So the challenges in terms of strengthening our patient safety, and we were also grappling with the issue of our unplanned admissions into the ICU. So, and then the solution was only the monitoring check, the manual monitoring check which used to happen every 3 to 4 hours. But I think while we do that, there was almost about 40 to 50% of the times we used to miss out on a lot of patient alerts fundamentally. So that was one of the challenges. Second was the delayed critical interventions. I think these were the two challenges. And then Dozee stepped in and we started using Dozee. With Dozee, fundamentally before Dozee, as I was telling you that there were almost about 60 to 70% of the spot checks used to go unnoticed, critical events used to go unnoticed. And it's a universal phenomena that during the nights, the efficiency of the hospital actually goes down by about 50 to 60% from a clinical perspective. It's put underneath the patient bed, and then we fundamentally monitor 5 major things. One is the respiration rate, the heart rate, BP, SpO₂, as well as the temperature across all the wards. So we have deployed about 84 Dozee beds in the hospital, which is totally monitored, and then this I think this was fundamentally a demo of Dozee bed. So primarily it is a continuous monitoring of the patients remotely. We phenomenal, almost 20%, 1932 were quite critical. And the action alerts were about close to 3,369. That means about 40% of the patients were immediately acted upon. Right? And nighttime critical alerts were almost 5 or 6, which is close to about 10%. And high-risk patient were more than 6%, that is close to 7%. Now what does all this means? All this means that we are fundamentally avoiding code blue situation in the hospital. We are primarily, taking action before anything emergency is occurring to the patient. Our nurses and doctors are actually helping the patients not to get into the critical events. So these are the fundamental story behind the metrics which I am present. So these are two typical clinical success stories which we wanted to give live example. So one was early detection prevented deterioration in an elderly patient. The patient was about 80 years old. Acute kidney injury on a CKD patient. Dozee's high alert, which gave high rate of 100 ppm and low SpO₂. The nurses actually picked up these Dozee alerts, and early escalation ensured timely management, and we actually saved the patient entering into the ICU as well as the patient life. So this is how Dozee actually helps the patient's life. Second typical case was alert for critical respiratory disease. A patient of 34 years of age with type 2 respiratory failure, portal hypertension, Dozee high alert of about 40 rpm, falling SpO₂, detected during the morning rounds. So the action which was done was the nurse confirmed the alert, ICU transfer was initiated, again preventing a major critical event in the patient. So these are typically a couple of examples. Now, in summary, what does Dozee does is it's actually proactive ICU shift for the patient before the critical event happen. There is improved nursing efficiency. Our efficiency of the nurses actually improves. The overall interventions of the doctors actually goes down. Thereby, they are able to do a better preventive work. Strengthening the audit rate. That means almost we tagged about 3,300 alerts, which improved the accountability of the compliance, as well as it also helped in the overall efficiency of the clinical management of the patients. So I think these were some of the features. All in all, I think I still remember the number. I think we have close to about 56 or 58 road blues were prevented due to Dozee. That's the fundamental satisfaction perspective. I think almost about 89 to 90% patient satisfaction we have noticed. There are about 18% lower treatment cost, and almost 97% of the deteriorating cases were captured early through Dozee. Of course, from efficiency perspective, again, 70% of the burden of the nurses actually came down, and overall, as I told you, about 80% cold blues came down in the hospital. So the bottom line is that with help of technology, with help of Dozee, by taking this preventive action, we were able to save a lot of lives. I'm sure Dr. Sudesh will put his perspective in front of us. Also,
Dr. Sudesh Patil, Senior Consultant, Internal Medicine, KIMS Sunshine Hospital, to the stage to present some of his observation and his success stories towards smart water.
I was very skeptical about the whole thing, and I'm a very non-technical guy. I don't trust technology so easily. I don't use WhatsApp. So I was not very sure whether it really records the data correctly or no. I always used to cross-check with my team and myself, is it really recording the data correctly or no? Because we don't know. I mean, the numbers flashing, alarms beeping, and the information was too much for the nurses to process. When you're getting alerts every now and then, nurses should know when to react, and otherwise it will take away a lot of their time. That was my worry, because if the alarms are too sensitive, it beeps whenever it crosses certain designed cutoff. So I was worried about the false alarms it may generate. So my initial view was to see whether it is really going to help or it is going to just create an havoc in the nursing station and my team to attend when it is not really an emergency. But I think with the data coming in and supported by several studies and otherwise, this is quite promising. It prevents human error, I feel, when the shift change. Early morning hours when doctors or nurses are a little exhausted at the end of their shift. Machine never gets tired, so it keeps recording. And any information coming in, you need to either react to it or at least observe it or make a note of it. Nurses cannot ignore it, that's probably is helping. So if at one odd point when there is no continuous monitoring happening, when it was not earlier, there were chances for errors and people getting into code. Just that lack of observation for a certain period of time. When there is no continuity in observation and continuity in vital monitoring, you miss out on an emergency. And then it appears as if it is, you miss out on the chance to treat. Then it becomes an emergency. So I was happy to have this when I was shifting my patients outside ICU. when they were critical, then suddenly wards where there is no monitoring. Maybe new updates coming in, it will add to the management. It will minimize the human errors and also the manpower requirement and the errors happening because of just fatigue should come down. Medical, all of us medical people, nurses, doctors and all of the staff is at one point we do get fatigue and there the error happens. This will bridge the gap for those things, I feel. So any new updates and all, I think Dozee team will update, but as of now from my point of view it is working quite effectively and just to put it through, I think Dozee should have run more studies to authenticate in medical journals so that it will come in the picture and then more and more hospitals.
And it is truly a great feeling for all of us to see someone of this stature coming and telling us that you are now relieved as a consultant. I would like to invite Sudhaker now to felicitate Dr. Sudesh Patil, whose remote patient monitoring and AI-based early warning system supports clinicians in delivering continuous data-driven care. To share a few words on this collaboration, may I invite Mr. Kaushal Pandya, Senior Director, Dozee to the stage.
Actually giving Dozee a chance in this hospital, because adopting new technology and in field of medical or science is always a challenging, and this is where the vision of both of them came to play, and they have given Dozee a chance, and you can see the outcome now is visible in front of us. So thank you from bottom of our hearts and on behalf of Dozee. Today actually my job is very easy because the benefit of Dozee and the technology and a lot of clinical aspect has been covered by. So today I thought let me use this opportunity to introduce a new upgrade or new device which we have recently launched, and I take this opportunity to launch this device here, and this device was launched few months back in US and Middle East. Now this is available in India, and that's what we called it Dozee VS. This Dozee VS has bedside monitoring. The device itself has the screen which provides the monitoring. This has a new device attached to it is called for the ECG monitoring, for Holter monitoring, and arrhythmia reports can be generated. And this is completely completely ambulatory device. So this is a short video.
Change the BP medication for the patient.
Sir was talking about the real world evidence for clinical study. This is one of the clinical study which we have done and published in Pandya Medical Technology Journal, where we Dozee solutions in Frontier. Again, sir has already covered up about the patient satisfaction study and the advantage of Dozee, which again this trial was done in. This product is a global product now. It's available in US, in Middle East, and India has been always a pioneer for us. And currently we are in 300 plus hospital monitoring almost 20,000 bed every day, and we are saving 50,000 lives. These are our market parameters where our product is available, and KIMS is. So we are on our mission to saving millions lives through healthcare. Thank you.
Thank you, Kaushal sir, for giving us the insight on how Dozee has been not just spreading their wings in India but also worldwide. I would like to request. we have come to the conclusion of the presentations, I would like to open the floor.
Smartwatch will be charged on par with IC watch or
No, not at all. That's the whole idea. We are not charging as per, the whole idea is to reduce the ICU stay of the patient, right? So these Dozee pads are only used in rooms and wards. They are not used in the ICU because ICU we have a comprehensive cover by our charge as ICU.
Yeah, sometimes these poor calibrated sensors can cause inaccuracies. How do you ensure that, your data is absolutely correct?
In fact, a good question. So what we do is when we get a Dozee, so there is an immediate manual check again to reconfirm whether the alert was a positive or a negative one. So that we have been doing. I think when we do this, there was a consistent, matching of the data when you do it with Dozee and when you do it manually. Has been a consistency almost to a tune of 99 to 100%.
Yeah, but then how do you ensure that your infrastructure is in place in terms of adopting this technology? Because this will again mean, additional costs.
Not at all. It's a very simple technology. I think you have missed the video. Yeah, you have missed the video. So it's just a simple pad which goes down underneath the bed of the patient, and are about 5 sensors which picks up those alerts, and and the remote patient monitoring happens on the nursing station. That's the whole beauty of this technology. So it is mobile. We can remove the Dozee pad whenever we want. We can just put the Dozee whenever there is a requirement. So that is as easy as changing a bed sheet of a bed.
Thank you. But is it interoperable? Because, there are multiple devices that are coming today and switching data from one to another. Is it possible at this level?
Devices are easily integratable with the, as I said in my presentation also, with the hospital information system as well. And actually Dozee doesn't get any data. We just pick up the patient vibration as our technology requires, and vibration we push the data. We don't have patient's name or age or any data, not even demography also. So just we get the vibration, we push the data to the hospital systems, and it is very much secure. And privacy is also being taken care of, which is a major concern in today's time, right? Because we are living in a world of AI and technology, so that's a major concern. So we are also operating in US and Middle East. We are following HIPAA compliance. We are certified, or we are following the compliance of Type 2 SOC. So system is very well compliant, easily integratable. Data resides only with the hospitals and not with the patient. When even the patient is sleeping, you monitor the patient, right? And that is from where we have derived the name Dozee.
ఇది యూజ్ చేస్తున్నాము కిమ్స్ సన్షైన్ హాస్పిటల్లో. చార్జెస్ ఆర్ డెఫినెట్లీ లెస్ దెన్ ఐసీయూ. ఐసీయూలో ఎంత ఛార్జెస్ ఉంటాయి, ఐసీయూలో కేర్ కంటిన్యూ చేస్తూ ఐసీయూ నుంచి చాలా వార్డ్లో ఇది అవైలబుల్ చేస్తున్నాము. సో కాస్ట్ ఆఫ్ థెరపీ కమ్స్ డౌన్, ఇంకా కంటిన్యూటీ ఆఫ్ కేర్ మాత్రం ఉండిపోతుంది. సో అదే మానిటరింగ్, ఐసీయూలో జరిగిన మానిటరింగ్ మన వార్డ్స్లో కూడా చేయవచ్చు. ధర చాలా వరకు తక్కువ, మచ్ లెస్ దెన్ ఐసీయూ ఛార్జెస్.
పేషెంట్కి సంబంధించి ఏ విధంగా మానిటరింగ్, క్విక్ రెస్పాన్స్ కావచ్చు, వైద్యం అందించడం కావచ్చు, ట్రీట్మెంట్.
అవును, రికార్డ్స్ 5 వైటల్ పారామీటర్స్: బ్లడ్ ప్రెషర్, హార్ట్ రేట్, రెస్పిరేటరీ రేట్, పేషెంట్ బెడ్ నుంచి దిగినప్పుడు అది కూడా అలర్ట్ వస్తుంది. సో ఇలాంటి వైటల్ పారామీటర్స్ రికార్డింగ్ కంటిన్యూస్ జరుగుతుంది. సో ఒక పాయింట్లో మనం సపోజ్ పేషెంట్ పక్కన నర్సెస్, డాక్టర్స్ లేనప్పుడు కూడా మనకి కంటిన్యూస్గా అలర్ట్స్ వస్తూ ఉంటాయి. సో ఇమ్మీడియట్ రెస్పాన్స్ అయ్యి ఎమర్జెన్సీస్ అవాయిడ్. దట్ ఈస్ అది. సో ఇట్ మానిటర్స్ హార్ట్ అండ్ లంగ్ పారామీటర్స్ అండ్ మోస్ట్ ఆఫ్ ద వైటల్ పారామీటర్స్. అట్ ప్రెజెంట్ ఒక వార్డ్లో అరౌండ్ 80 బెడ్స్కి అది ఉంది.